good spot here on this side. Occiput, just relax. Oh yeah, that was it there. So what's going on today? Anything going on today?
My neck.
Neck?
And
Okay.
I think I've been getting headaches.
Okay.
So I think my ears maybe.
All right, well, let's check it out then. Carry on. So, and low back's doing okay?
Low back doing pretty good, yes.
Okay. Good. That's a little tight. Okay. Let's lay this side up here. That was ready to go. Okay, flip over to the other side. Good, all right. And the headache's been like in the back of the head, or where are they at?
I got front.
Oh, okay. Sometimes up front they can be sinuses, but we can check. Yeah, you got a good spot here on this side. And this one's a beauty. Occiput, just relax. Oh yeah, that was it there. All right, that was the occiput on that left side. That should take care of it then.
Thank you, Doc.
All right, that'll do it then.
Feels great.